It wasn't until 2017 that I was diagnosed with type 2 diabetes. Scared me. The endocrinologist that saw me for the type 2 diabetes, he said to me, okay, well, this is what you have. It's not going away. You just have to manage it. So he gave me three medications: metformin, Jardiance, and Victoza. I heard about diabetes before, but I didn't think that I was going to be the one to get it. I think there's five markers of metabolic syndrome: low HDL, high blood pressure, high triglycerides, high fasting glucose, and then belly fat, obesity. So I had four of the five. The only thing I didn't have is high blood pressure. So me eating the old standard American diet way, I had metabolic syndrome. I went to the doctor because I was having low abdominal pain, and they diagnosed it as diverticulitis, and they said, here's an antibiotic, but never once said, hey, you need to change your diet, you need to watch what you're doing, watch what you're eating. And then I got gout, which is excess uric acid levels in your body. I had probably 4 or 5 bouts of gout from 2014 to 2017. And again, I was never told any dietary guidelines that I need to follow. The only thing I was given was medication, alpurinol, to reduce the inflammation from the uric acid. And then with the kidney stones, same thing. I passed the stone. The urologist looked at it, analyzed it, but no diagnosis, no, just you got kidney stones, and that's it. I had 2 bouts with kidney stones. And again, never was told, hey, you need to change your diet and you need to get healthier, right? It wasn't until 2017 that I was diagnosed with type 2 diabetes. Scared me. I heard about diabetes before, but I didn't think that I was going to be the one to get it. But looking back, all those issues that I had were precursors to type 2 diabetes. And they say you really can go back 10 years. And that's when, from the diagnosis, that's when you really started to become sick. The endocrinologist that saw me for the type 2 diabetes, he said to me, okay, well, this is what you have. It's not going away. You just have to manage it. So he gave me three medications: metformin, Jardiance, and Victoza. So the three medications he gave me was to get my blood sugar down. And they did work. They got my blood sugars down because I went back 6 months later and got retested. So my A1C was 9.2 initially, and it went down to in the sevens within a year from taking the medication. But again, I really wasn't told that my diet is the main cause of me having all these metabolic issues. He sent me across the hall to a dietitian, and she gave me the American Diabetes Association plan, My Plate, I think it was called. And here's what you have to do. Here's the foods you have to eat. And she was telling me, you could eat, give me some examples and say, oatmeal with fresh fruit in the morning, and you could have breakfast cereal, heart healthy oats and grains, and pasta with grilled chicken, all the things that, in our heads, they sound healthy. And I'm going to a registered dietitian, so I'm assuming that what she's telling me is the right way to do it. So I did that. And I did lose a bit of weight initially from the medication and changing a little bit of my diet. One day I was doing it, I said, this is not right. I can't be on these medications. I'm taking 3 different medications. I don't really feel any better. I still feel like kind of not lethargic, but just brain fog, and, didn't feel like I had motivation to do anything. And so I said, this isn't right. I started researching and I started eating cleaner and healthier, but and exercising. I began exercising. What I was eating was what they tell you to eat: exercise more, right? That's the formula that everybody says will get you healthy and to lose weight. And I did that and I lost 70 pounds, but I lost a lot of muscle and I still didn't feel good. When you hear people that are healthy and they're vibrant and they want to go out and do things, that wasn't me. I still didn't feel that way, even though, I went to work every day. I went to the gym after work, trying to exercise like everybody else, running on the treadmill and, just like doing as much as I could to become healthy. So I lost the weight, but I lost a lot of muscle and I didn't feel good. So I said, this isn't the right way either. 2021, I started researching carnivore diet. Finally, I'm in 2022. I said, well, I'm going to try it because I feel like most people and being in the space now, most people are last resorters that come into carnivore. Like they've tried everything else, every other diet, and then this is the one that everybody said is the proper human diet, the way we should be eating, like our ancestors ate. So I said, well, I'm going to be one of those last resorters and I'm going to try this because nothing else is working. I tried numerous other diets and they all failed. I actually put most of the 70 pounds back on. So in 2022, I started eating carnivore. I joined a challenge by one of the influencers, Dr. Chafee, and I started eating carnivore. I started feeling good, feeling better. I started losing weight. I was still exercising, but I was putting muscle back on. I feel like I completely transformed from the way I was, which was sick and on a bad path to getting older and being sick, to now being healthier, feeling healthier, looking healthier, feeling more confident, waking up in the morning feeling like, I'm ready to start my day. From the minute my feet hit the floor, like I'm ready to go. That's how my day starts. While I was 9 months into it, they were filming a television show in Costa Rica, and it was called Reversed Carnivore. They were looking for guests to be on the show, so I just put my name in the mix, and then they called me up and they asked me if I wanted to be on the show. So I said, yeah, absolutely. I felt like it was the perfect time for me to get involved because I had not been a long-term carnivore. I was just 9 months into it, which is fairly, it's not a lot of time compared to some of the people that are 16, 18 years in carnivore. But Dr. Chafee was going to be there, Dr. Berry, Dr. Kiltz, and then Dr. Sarah Zaldivar, and all these doctors, and there was some other guests that were going to be there, experts. Bella from Steak and Butter Gang was there, and it was a retreat kind of that they were going to help us understand carnivore diet, how to do it, why it's the best way. So we filmed the show for, I think it was like 4 days we were there. And I got to meet all these people and pick their brains and ask them why, how, when, where, what should I do. So that for me was the biggest motivation to then keep on chugging along in carnivore, because when you see all these people and you see what they do and how they do it and what they look like and how healthy they are, like that's what you want to be. I want to be healthy. I wanted to lose weight, of course, but I really wanted to be healthy. That was my main goal. And that really should be everybody's goal. Weight loss actually will happen if you become healthy and start eating healthy. The weight will fall off, but you have to nourish your body first before the weight will come off. So I think that's the biggest point. But anyway, so I had no doubt, and especially after the trip, I got back, and it's actually on Dr. Ken Berry's YouTube, all 5 episodes of the show. But that was like, for me, that was like the defining moment in my journey to say, yeah, I'm gonna keep doing this. I got super motivated from when I got back from that trip. So my one doctor, when I had fatty liver disease, I think my AST was 240, which is like, it's supposed to be like 40, which is a liver enzyme. And she recommended me to go to a liver specialist. And I never went because I changed my diet. But the next time I went, a year later for a checkup, she said, "What did you do?" She's like, "Your liver numbers are like almost near normal." She's like, "What did you do?" I said, "Well, I just changed my diet." She was like, "Well, keep doing what you're doing then." And that was it. She didn't inquire about what kind of diet or what I did, or, you want your doctor really to seem interested in your health, right? They're supposed to be your partner, not just, here you go, take this, here you go, take this. And that's unfortunately a lot. They have probably good intentions too, but I feel like a doctor should be your partner. They should work with you and learn from you, right? I feel like a doctor should learn from, if you're doing something right and it's working, and maybe that's something that should be looked into, for future patients. I had psoriasis. Doctor was giving me creams for my hands and trying to alleviate all these symptoms. My hands were cracking. I had every finger was taped because they were bleeding. But they just gave me cream, cream, cream. And she said the next thing we'll do is injection, like a steroid injection. No, and that disappeared. When I had the diverticulitis, the last time my gastroenterologist said, looks, I'm going to recommend you to go for surgery to remove part of your colon. And I was like, what? I wound up that I haven't had an issue with my diverticulitis since then. Everything with my digestive system seems to be working how it should. But yeah, they don't, the doctors sometimes they are surprised when they see the dramatic weight loss and what you do, but that's kind of where it ends right there. Probably the biggest thing in the beginning was just I felt more active. Like I wanted to go to the gym and work out. I wanted to be healthy. I wanted to do, and then so just I would say overall activity level initially. And then the last thing is probably my sleep is a lot better now. I used maybe 4 or 5 hours of sleeping. I'd wake up super early in the morning, couldn't sleep. Now I'm getting 8 hours, 9, 10 hours of sleep a day. And I feel that's also important to becoming healthy. Your body needs that time to rest and, regenerate. I learned in this process that I'm addicted to sugar, kind of having to eliminate sugars and carbohydrates. Right now, I'm zero carbohydrates. I don't do fruits, I don't do vegetables, grains, pastas, bread, none of that. I had to eliminate it because when you're an addict, it's very easy to fall off the wagon and get back into your old ways. And for me, my old ways would have been will be getting type 2 diabetes again, putting on excess fat, storing fat, excess glucose, insulin rises, and you're storing fat, right? So that's what would happen to me if I went back to eating sugar and carbohydrates. And I don't know if you know Steak and Butter Gang, and they have a program that you follow. So with you first, you prime, which is nourishing your body. So it could be 2 weeks, could be 2 months, but you want to kind of like overfill your cup and take in more nutrients than you normally would, sometimes 2 to 3 times. And once your body's nourished, your body kind of feels safe now to say, okay, I'm where I'm supposed to be. Now let me start working on fixing all these issues. So I did the nourishing for 2 months, and then they kind of have a protocol with fasting where they put you through, gently get you involved in fasting versus just saying, I'm going to do a 24-hour fast. Because then most of the time that fails because you do a 24-hour fast, you're not used to it or comfortable with do it because everybody else says to do it. And then when you get off the 24 hours fast, which is your most important time to get your nutrients in, well, it's actually what you put in is the most important. Most people just will binge eat because they're like, I haven't eaten 24 hours. And, you're already planning your meal out in your head, what you're going to have and where you're going to go, what you're going to eat. And you're like, I did all these great benefits, but then they ruin it with overdoing it or putting the wrong foods in. Super important. And that's what they do in this protocol is they kind of teach you how to like slowly build up that fasting muscle so that when it comes time to do a 24, a 48, or 72-hour fast, you're ready for it and you don't have those massive hunger cravings and your body's adjusted to that. That to me was the biggest thing. And that actually is what eliminated my sugar cravings. Because even though I was carnivore before I joined this group, Steak and Butter Gang, even though I was carnivore, I was still having the cravings. And at the nighttime, for me, it was the worst. The nighttime, I would, before bed, after work, I would come home and I would eat. If my kids had chips or dips or ice cream, I would just eat like in my head, I was telling myself, I ate good all day or I fasted all day. So now this is like this is a treat for me. But that treat, what it was, and the time of the day it was right before bed was super detrimental to my health. So there was nothing good that was going to come out of that. Probably a lot of my stall or lack of progress initially in carnival was because I was still including those bad foods. Even if it was just one stack of cookies or whatever, it would still have a negative effect for me. By priming and then fasting, it eliminated my cravings for sure. I don't have any sugar cravings anymore. And 80 million people in the United States have metabolic syndrome, and they're obese and they have all these other risk factors that are associated with metabolic syndrome, disease, type 2 diabetes, insulin resistance, fatty liver, gout, sleep apnea, like all these. And I don't think they even know that they're doing anything wrong. They think like this is what we're told to eat. This is how we're supposed to eat. This is what I grew up eating. And I did. I grew up eating fast foods and sodas, high fructose corn syrup and ketchup. High fructose corn syrup is no good. And it's just and how your body processes it. It's a recipe for disaster, if you ask me. So I really feel like I transitioned from being very unhealthy and on a path to being sick to now feeling like I have it under control. I'm not on any more medications. After a year of being on medications, I got off of everything, and now food is my medicine. So for me, this works, and I'm eating the best possible way I could eat to stay healthy and not go back to the way I was. You'd be surprised how the body's resilient. The body will heal itself, but the body needs a chance to heal itself. And if it never has the chance because the foods that you're putting in your body are constantly having negative effects, your body will never have a chance. Your body's going to hold on to everything it can. If it's in like a crisis mode, I mean, if you're sick and you have metabolic syndrome, your body's always in crisis mode. Let any resources go because people want to lose weight. It won't let any resources, fat, go because it's holding on to it because the body thinks like, hey, I may need this because I have all these issues and I need to fix them, and it'll prioritize the issues. It's not going to work on your hair and your nails and, looking pretty skin when it has a fatty liver or it has excess uric acid buildup in your body. So it's going to work on the most important things first, but it will never release anything if it's in a crisis. It's going to hold on to all its resources. People think the medication is just the buffer to keep the symptoms away while you're still eating the bad food or drinking the alcohol. I knew somebody that got gout attack in their knee, I think, or their ankle, and to the point where they couldn't walk. Just like me, I had the same problem. But they were still drinking alcohol while they had it, but they were taking the medication to make the symptoms go away, but still drinking the alcohol. So people use the medication as just kind of like green light to just continue doing what you're doing, and the pills are going to make the problem go away. People get acid reflux, people get digestion issues if they eat certain foods, all these bad foods that we're eating, right? So where they tell you to take a pill before you go out to dinner and you won't have any heartburn, right? Take this and the heartburn will go away. Take it before in preparation for eating the bad foods that are going to give you the heartburn. You're out there buying this medication, even if it's over the counter, so that you could eat the bad foods that are going to give you the problems. So if you look at it like that, is it worth it? Does it make sense? But they made it to the point where the food that we're eating is so addictive. You just going for that no matter what, even if you got to take a pill. That's the sad part, is that you're trying to negate the effects of the bad food you're eating by popping a pill. So that's where, if you really sit down and think about it, doesn't make sense. I enjoy helping people now. I really want to get out there and be able to help other people understand the consequences of eating these bad foods. And I think it's big now, even within the government. It's part of the election this year about making America healthy again. So all these initiatives and these influences like Callie Means, and he's like a big influencer on, eating healthy, and plus everybody in the carnivore community kind of speaking out and just getting the word out that, maybe you don't necessarily have to be carnivore. Maybe that's the extreme. For me, I have to do that. Some people may be okay with doing a ketogenic diet where there is 30, 40 grams of carbohydrates, healthy carbohydrates within that diet, and that's fine for them. For me, that doesn't work because it'll stimulate me to become back to my addiction to sugar. For me, that doesn't work. But yeah, so my family, they're not doing carnivore. They don't mind that I do it, and they see the results. I'm just waiting for them to one day say, "Hey, Dad, what do I have to do? Show me what to do. Tell me what to do because I want to be healthy." We all think when we go food shopping, I pay attention now to the people that are shopping in the store, and I see what they're grabbing, off the shelves, whether it's snacks and cookies and donuts. And that was my guilty pleasure was potato chips and donuts and cookies and all that. It wasn't even so much with the fast food. It was all the snacks, but those snacks are so addicting. And I watch the people now and they're shopping and I see what they're putting in their wagons and the 2 liter bottles of soda. And I want to say something, but I restrain myself from doing that. But occasionally I'll say to somebody, if somebody's looking at the label or something, I'll just make a comment, say, "Hey, that's not so great for you. You might want to grab that instead." If they're grabbing oil and they're looking at sunflower oil or canola oil, which is they're so bad for us and they do so much damage. But the problem is it's not the lady that buys it and goes home and just sprinkles a little on her salad. It's all the other foods that have that sunflower oil, canola oil, vegetable oil, all those foods that they're eating on top of what maybe they're making at home, which might not be so bad. It's not the one time you do it, it's when you do it 100 times. That's when it becomes bad. Yeah, so a typical meal for me, it's so simple, but ground beef, minced meat, or I'll have a steak occasionally. I usually don't because I like ground meat better, but I just try and do different variations of ground beef, but it's always ground beef. It may have cooked in beef stock. I love eggs. I'll do eggs, just the yolks I do because the whites I don't agree with. I don't agree with me, but I do egg yolks. I do beef. That's it. There's not a lot of fat. I feel like high fat is super important for hormones. I definitely include a lot of fat in my diet. And I think most people are scared because that's what we've been told, right? To stay away from fat. But body makes cholesterol, but I feel like they've made it out to be a bad thing, fat, when your body, yeah, actually needs it. But a typical meal is just ground beef, whether it's I make it into meatballs or a meatloaf or a burger patty, some eggs, a couple eggs and butter. That's a typical meal. In my gym routine, I try and get to the gym. I used to do more, 5, 6 days a week. Now I'm like 3 days a week to just maintain. During my weight loss, I'm also gained muscle. I lost fat and gained muscle. I feel like I'm in a good place with the amount of muscle that I have right now. I'll go 3, 4 days a week. I only do now strength training. I don't do any really much cardiovascular like the treadmill or anything. I'll do sprints. Sometimes there's a doctor, Sean O'Mara. He's very big on sprinting to get rid of your visceral fat on the inside. So I'll do that sometimes if it's nice out and I can get out. I'll do some sprints, but so that's my kind of workout routine. I do the cold therapy. I found it online on Instagram. I seen some people do it. I saw the benefits that they were talking about. So I said, well, I'm going to try it. I started doing it. So I just bought a bunch of bags of ice and, I just jumped in it. It was like 48 degrees. And I really, though, I'll tell you, you feel something different in your body when you do that. I don't know if you've ever done it before, but it's like you feel like supercharged. When you get out, whatever happens in my body anyway, when I get out of that for the next couple of hours, I just feel like it knock walls down. I just feel like supercharged. When I go into something, I give it 100%. I go in a very determined person, and if I'm going to do something, and I'm going to do it the right way, by the book, this exactly the way it says. I was on carnivore for 9 months. And that's the other thing I like to just address quick is people think that because they start eating healthy, that it's just going to happen overnight. They're going to get healthy overnight. It's not. I was probably 20 years of eating unhealthy and destroying my body. And then I'm not going to heal in 6 months or 2 months or 3 months. Yeah, I may lose a little weight here and there, but I'm not going to completely heal my body from all the damage that I caused, over the years, whether it was from eating, smoking, no exercise. So People think it just happens overnight. It doesn't. I'm on 7 years now of healing. From where I was to where I am now, 7 years. Only the last couple of years carnivore, like a little over 2 years. But I had no doubt after I began, I knew it was going to work because I did a lot of research on it before I kind of jumped into it. Everybody tells you stay away from meat. It causes cancer. It causes issues with your bowels. It causes digestion issues. So all roads pointed away from meat, and I'm going down the road that says only eat meat. So you have that in your head, right? That, hey, am I doing the wrong thing? Am I going to have cardiovascular issues? Am I going to get clogged arteries? Am I going to have digestion issues? But I said, this is, the last resort, right? This is the path I'm going to go down and try. And I did it. And everybody's looking for the magic pill. And there is no magic pill. Not even the Ozempic or the Wegovy, all these shots people are getting to lose weight. Studies have already shown that the weight will come back on. It's not good unless you stay on it forever. So there is no magic pill. You have to do the work, So, it's hard. It's not easy. But you have to be resilient in order to come out a healthier person. If you do something and it makes you feel better, then stick with it. Make it work. Exercise. If you're able to get up and get out, and I don't care, or even if it's in your house, do something. When you get older, you want to have muscle when you age. So I think it's super important to get out, and if it's a walk or it's the gym or it's something in your house, walking around your kitchen, it's super important to be active. But carnivore for me works. I would say give it a try. Doesn't work for everybody, meaning that, some people, they can't eat meat every day. It's just something that they won't do. But if you can, you'll see the results. It'll show and you'll shine.